Okay, so in this lesson, we're going to be discussing the principles of disease control within the context of epidemiology. And these principles are actually applicable not just to communicable disease epidemiology, but also to non-communicable disease epidemiology. And control, unlike prevention, has a very specific terminology and has very specific meaning. So when you talk about control, you're looking at ongoing operations, things that are done very regularly, that have a focus, an aim to reduce the incidence of disease, to reduce the duration of the disease, to reduce the risk of transmission of the disease, to reduce the effects of the disease, the negative impact, both physical and psychosocial the effects of the disease, and the financial burden. So when we talk about reducing So when you talk about control, you're actually looking at all operations that are focused at. And then operations are things that you do, activities you're engaged in on a fairly regular basis, every day, every week, every month, very regularly. You are activities you're engaged in that reduce the incidence of the disease, reduce the duration of the disease, reduce the risk of transmission of the disease, reduce the negative effects of that disease, including the complications, physical, psychosocial complications that could happen, and the financial burden to the community. So when you say a disease is controlled, you are saying that incidence, prevalence, risk of transmission, effects of the infection, and the financial burden are at a point where it is no longer necessary for public health actions and activities to be invested in that effort of controlling the disease. So you see, that's different from the concept of prevention. But what you need to understand is that control is an aspect, one of the aspects of prevention. For you to do prevention properly, a disease condition that has already caused infection, you will need to do what you can control it within the individual and then from one person to the other. That is, you have to have activities that have to do with making sure that the individual gets well, and then also making sure that the disease is not transmitted from one person to the other. So control activities focus primarily, majorly on primary and secondary prevention, majorly on primary, secondary prevention. And there are 3 levels of control. When we talk about control, we talk about it in 3 levels. Level 1 is control, level 2 is elimination, and level 3 is eradication. Level 1 is control, elimination, and eradication. So I guess we're going to look at them. We looked at what control is and what it means. But when you want to go for any particular disease condition, you want to go beyond control, the next place you want to get to is elimination before you get to eradication. So elimination gives you the sense is describing interruption of disease transmission. So you need to be very clear that for you to talk about to be on the pathway for elimination, there needs to be evidence that there is interruption of disease transmission. What that means is that the disease is no longer being passed from one person to the other, or from the environment, or from a vector, or from a source, or from a reservoir. The infectious agent or the risk factors are not being transmitted. It's not moving from one individual to the other. And so elimination talks about the reduction to 0 of the number of cases of a disease, the reduction to 0 of the number of cases of a disease within a geographical region. So when you have a situation where there is when you have a situation where there is elimination, that disease doesn't happen. For example, polio has been eliminated in Nigeria. Now, there's still polio in some other parts of the world. That means that the disease transmission has not been interrupted. For us to be declared polio free, we had to go through, I think it was 3 years of zero cases. 3 years of zero cases. And the reason why cases are important is that polio is transmitted from person to person. So through the fecal oral route. So if you have even one case of polio, there is a possibility that that case, that person can transmit to somebody else. So, but when you no longer have cases, it means you have interrupted transmission. Like, for example, how did we know that the Ebola was no longer a problem? How did we know that we had brought it under control? And as it were, in that context, at that time, eliminated Ebola from Nigeria. How did we know? We went for the longest incubation period is 14 days. So we went for 14 days without any case. And then we went for another 14 days without any case. So for double the longest incubation period, there were no cases. We say, okay, we no longer have a problem with Ebola. So it's the same for other diseases where you have to understand how transmission happens. But specifically, WHO, the terminology elimination depends from disease to disease, but most cases, you would have proven that for a minimum of 3 years, you do not have a single case of the disease. You can now say you have eliminated that disease and transmission is over. So examples of diseases that have been eliminated, polio is a case that comes very strongly to mind. And there's some other diseases are being pushed for elimination. Interestingly, malaria is one of the diseases that is being pushed. A lot of efforts are going on for elimination of malaria. Some other neglected tropical diseases like yours, like hookworm, like there's some other diseases that have been marked, targeted for elimination. If you know some other diseases that have been targeted for elimination apart from polio, measles, diphtheria. If you know any other disease, please put it in the chat box. Write it in the chat box. Let's learn. Don't guess. You don't know, don't bother. If you know, share with us. So one more step is eradication. So eradication means the termination of all transmission of the infection by the extermination of the infectious agent. In other words, the infectious agent no longer exists all around the world. Note that this is all around the world. The infectious agent no longer exists. So you have done the termination of all transmission of infection by the extermination of the infectious agent. And it's important to put that into context because it is possible for you to have a reduction of cases to zero, an ending of transmission, but the infectious agent is still very much rampant in the environment. What that means is that it is an uneasy victory, and under the right circumstances, there can be a resurgence or re-emergence of that infection. Okay, so when a disease is eradicated, the infectious agent does no longer exist in the natural environment. In nature, in the environment, in the whole wide world, it no longer exists. That disease will no longer occur in human populations. However, that the infectious agent may still exist in laboratories under very high security because they will be thinking that maybe in future this or something like this may come up again. Let's be ready to respond. Smallpox is currently eradicated. Eradicated, I think it was 1978 that smallpox was eradicated. So it's important to note that. And it's the only disease that has been successfully eradicated around the world. But when you say that disease no longer exists at all, neither in the natural environment nor in laboratories or even experimental laboratories, you say that that disease condition is extinct. Extinction. Extinction says there's nowhere you can find it. So smallpox has been eradicated, but smallpox is not extinct. So going back to principles of control, when we're talking about control of infectious diseases, this diagram is very useful to see various control measures. And remember, control measures are mostly primary and secondary levels of prevention, activities in the primary and secondary levels of the disease, which means that they are interested in the risk factors for the disease have occurred, and they're interested in when the disease has also occurred. And if you now look at it, the 4Cs principle identifies 4 different aspects or 4 different ways that control efforts can happen based on our understanding of infectious diseases and how they spread. So cases, contacts, carriers, and community. When it comes to cases, what can you do for people who have contracted the infectious agent and have now become cases? You do diagnosis. In fact, screening is supposed to be here. Screening is supposed to be there above diagnosis. Screening is supposed to be there. Not diagnosis and disease notification. What is disease notification? There are certain diseases when we do integrated disease surveillance and notification or surveillance directly, you would learn that there are certain diseases that have been identified for reporting to the State Ministry of Health, Federal Ministry of Health, and WHO when that disease occurs, because we are really on the lookout and we're watching out for that disease. If it occurs, if we have been able to diagnose it, instruction is reported. So what do you do for people who have already been infected, already have the disease, whether apparently or inapparently, whether it is manifesting signs and symptoms or not? What do? You want to quickly make a diagnosis, do disease notification, isolate the disease, cause disinfection to happen. I'll explain disinfection in a moment. Okay, so I was talking about disinfection. Disinfection can either be strict, standard, or protective. So disinfection means that you want to identify the infectious agent and you want to destroy it. You want to identify the infectious agent and you want to destroy it by using some chemical means. Treatment so that cases that are ill can quickly get well, can quickly get better. You want to do follow-up, and then you can now release them from isolation. Isolation is keeping a confirmed case of a disease away until he or she has been properly and completely treated and is no longer ill and no longer able to transmit the disease, transmit the infection. So you isolate for 2 reasons. One, for purposes of treatment, but more importantly, you isolate because you do not want the infected persons to be able to infect others. What do you do with contacts? Contacts are people who have been exposed, who are likely to have been exposed to the infectious agent from an infected person from a case. They have not been confirmed to have the disease yet, but they are contacts of of a case. When you suspect that you are dealing with a contact of a case, there are a couple of things you can do. You can do quarantine or observation, but the word quarantine specifically refers to keeping suspected cases of a disease away from others or from other people for the longest incubation period, of that disease. So the idea is that if somebody is a contact within the normal incubation period, you should demonstrate signs and symptoms of the disease if he or she has been infected. If he or she does not demonstrate the typical signs and symptoms or does not test positive after the longest incubation period, then there's no need. When I use the word longest incubation period is usually a range. We'll tell you 5 to 7 years, 3 to 8 years. It's usually a range. It's not one, you can say average incubation period, but usually incubation period is a range. So what you want to do, the upper limit of that range, keep that person away for that length of time to see whether the person develops disease. And if it does, then of course you can move from quarantine to isolation and start to treat that disease. If it does not develop a disease, you can release into the society. For people who are asymptomatic carriers, who are asymptomatic but are able to spread the infection, are able to spread the disease, what you need is detection of carrier states. Screening is a useful tool for detection of carrier states. It is. There's some diagnostic testing are also good, very good for detecting carrier states. And finally, what do you do in the community? You do an epidemiological investigation and containment within the community, especially if you have it as an outbreak or an epidemic setting. There are certain steps to take for investigation and containment and control. So, summary, prevention is interested in activities that will promote health, preserve life, restore health when it has been impaired, and minimize suffering and distress. While control is first activities over primary and secondary prevention that looks at reducing the incidence, the prevalence, the duration, the transmission, the complications, and the financial burden of it. All right. We'll stop here for a bit.